Recent scientific research continues to demonstrate the complex and predominantly harmful effects of alcohol consumption on human health. Multiple large-scale meta-analyses and systematic reviews published between 2023 and 2025 have provided increasingly sophisticated evidence showing that alcohol consumption poses significant health risks across multiple organ systems. With important dose-response relationships and virtually no safe consumption threshold for many health outcomes, the emerging consensus from this latest research challenges previous notions of protective effects from light drinking and emphasizes the exponential increase in health risks with higher consumption levels. The most striking finding from recent cancer research is that alcohol-related cancer risks extend far beyond heavy consumption to include even light alcohol use. A comprehensive 2023 meta-analysis of 139 cohort studies involving cancer outcomes found a clear dose-response relationship where cancer risks increased progressively with alcohol consumption levels. This study specifically demonstrated that light alcohol consumption was significantly associated with higher risks of esophageal, colorectal, and breast cancers, leading researchers to conclude that there is no safe level of alcohol consumption associated with cancer risk. The magnitude of these risks varies substantially by cancer type and consumption level. For oropharyngeal cancers, relative risks range from 1.13 for light drinking to 5.13 for heavy drinking compared to non-drinkers. Esophageal squamous cell carcinoma shows similarly dramatic increases, with relative risks of 1.26 for light consumption escalating to 4.95 for heavy consumption. These findings represent some of the strongest evidence to date that alcohol acts as a carcinogen across multiple cancer types, with effects beginning at very low consumption levels. Gender-specific cancer vulnerabilities. Recent research has identified important gender differences in alcohol-related cancer risks. Female breast cancer shows particularly concerning patterns, with even consumption of less than 1 standard drink per day associated with a 4% increased risk. The 2024 meta-analysis specifically examining breast cancer found relative risks of 1.05, 1.1, 1.18, and 1.22 for 0.5, 1.2, and 3 standard drinks per day respectively, compared to non-drinking. This research confirms that alcohol consumption increases both premenopausal and postmenopausal breast cancer risk, with each additional standard drink per day associated with a 3% higher risk in premenopausal women and 10% higher risk in postmenopausal women. Synergistic effects with smoking. A 2024 systematic review revealed particularly alarming synergistic effects when alcohol consumption combines with smoking. The interaction effect becomes progressively more pronounced with increased consumption of both substances, reaching a relative risk of 35.24 for the combination of heavy alcohol and heavy smoking. For head and neck cancers. For specific sites like oral cancer, this combination produces a relative risk of 36.42, while laryngeal cancer shows a relative risk of 38.75. These findings demonstrate that the combined effects of alcohol and smoking far exceed the sum of their individual risks. Cardiovascular system effects. Recent dose-response meta-analyses have clarified the relationship between alcohol consumption and hypertension risk. A 2024 systematic review of 23 studies found a positive and almost linear association between alcohol intake and hypertension risk above 12 grams per day. The research demonstrated risk ratios of 1.11, 1.22, and 1.33 for consumption levels of 24, 36, and 48 grams per day respectively, using 12 grams as the reference. Importantly, this research revealed significant gender differences, with the association being linear in men across all exposure levels, but only appearing above 12 grams per day in women, though with steeper increases at high consumption levels. Arrhythmias and cardiac rhythm disorders. Contemporary research has substantially advanced understanding of alcohol's effects on cardiac arrhythmias. A 2023 comprehensive review confirmed that heavy alcohol consumption significantly increases risks of atrial fibrillation and sudden cardiac death. Mechanistic studies have revealed that both short-term and long-term alcohol exposure affects atrial electrophysiology by slowing conduction velocities and reducing effective refractory periods. Human studies using controlled alcohol infusions demonstrated that acute alcohol exposure significantly decreases pulmonary vein effective refractory periods, providing direct evidence for alcohol's immediate arrhythmogenic effects. Stroke risk patterns. The relationship between alcohol consumption and stroke continues to show a J-shaped pattern, but with important nuances revealed by recent research. A 2014 dose-response meta-analysis of 27 prospective studies found that low alcohol intake was associated with reduced risks of total stroke, ischemic stroke, and stroke mortality, but heavy consumption increased total stroke risk by 20%. However, moderate consumption showed little protective effect, challenging previous assumptions about cardiovascular benefits from alcohol. Cardiovascular disease paradox. Recent research has highlighted the ongoing controversy regarding alcohol's cardiovascular effects. A 2024 burden of proof study comparing observational data with Mendelian randomization studies found conflicting results for ischemic heart disease. While cohort and case control studies suggested protective effects from low to moderate consumption, Mendelian randomization studies designed to reduce bias showed either no association or harmful effects. This discrepancy emphasizes the complexity of determining causal relationships and suggests that previous observational findings may be confounded by other lifestyle factors. Alcohol use disorder and liver disease. The latest research on alcohol use disorder treatment in liver disease patients shows promising but underutilized therapeutic approaches. A 2025 meta-analysis found that alcohol use disorder treatment reduces alcohol relapse by 73% with any treatment and by 77% with medications in patients with alcohol-associated liver disease. Despite these benefits, the research revealed that remarkably few patients receive treatment, with only 346 patients enrolled in randomized clinical trials despite 581,556 cases of cirrhosis in the United States in 2017. Hepatitis B interaction effects. Groundbreaking 2024 research established quantitative dose-dependent relationships between alcohol consumption and liver disease progression in hepatitis B patients. This meta-analysis of 45 studies involving 33,272 patients found that each daily consumption of 12 grams of alcohol increased cirrhosis risk by 6.2% and hepatocellular carcinoma risk by 11.5%. The research demonstrated that compared to non-drinkers, alcohol consumers had 2.61 times higher odds of developing cirrhosis and 2.27 times higher odds of developing hepatocellular carcinoma, non-alcoholic fatty liver disease. Research examining alcohol's effects on non-alcoholic fatty liver disease has revealed complex interactions. A 2023 meta-analysis found that moderate alcohol intake increased the risk of advanced fibrosis in cohort studies, though it appeared to lower the risk of steatohepatitis. Importantly, while light alcohol consumption protected against all-cause mortality in the general population, this protective effect was not observed in patients with non-alcoholic fatty liver disease who consumed moderate amounts. Global health burden and mortality. The World Health Organization's 2024 Global Status Report provided updated evidence on alcohol's massive health burden worldwide. The report documented 2.6 million deaths per year attributable to alcohol consumption, accounting for 4.7% of all global deaths. The breakdown of these deaths revealed 1.6 million from non-communicable diseases including 474,000 cardiovascular deaths and 401,000 cancer deaths, 724,000 from injuries, and 284,000 from communicable diseases. Particularly concerning was the finding that 13% of alcohol-attributable deaths occurred among young people aged 20 to 39 years. Alcohol use disorder incidence and mortality. Recent research has quantified the exponential relationship between alcohol consumption and alcohol use disorder development. A 2024 meta-analysis found that at an average consumption of 4 standard drinks per day, the risk of developing alcohol use disorder increased sevenfold, while the risk of dying from alcohol use disorder increased fourfold compared to non-drinkers. Even at relatively low consumption levels of about 1 large beer per day 20 grams, the risk of developing alcohol use disorder was nearly threefold that of non-drinkers, with mortality risk approximately double. United States mortality trends. The 2024 Pain in the Nation report documented concerning trends in alcohol-related mortality in the United States. While the alcohol-induced mortality rate decreased by 6% in 2022 to 13.5 deaths per 100,000 people, representing the first decrease after more than a decade of increases, the overall burden remains substantial. Between 2002 and 2022, combined deaths due to alcohol, drugs, and suicide increased by 142% from 74,003 to 207,827 deaths. Specialized health effects, kidney cancer and metabolic interactions. Innovative 2025 research has revealed how alcohol's effects on kidney cancer risk depend on glycemic status. Among individuals with normal glucose metabolism, alcohol consumption showed a modest U-shaped relationship with kidney cancer risk. However, in diabetic individuals, a dose-dependent increase in kidney cancer risk was observed, with light to moderate consumption associated with a 12% increased risk and heavy consumption with a 24% increased risk. This research demonstrates the importance of considering individual metabolic status when assessing alcohol-related health risks, frailty and aging. Recent research on alcohol's effects on frailty in older adults has challenged some previous assumptions. A 2024 dose-response meta-analysis found that each 12-gram increase in alcohol intake was not significantly associated with pre-frailty or frailty risk overall. However, nonlinear analysis suggested a slight inverse association with frailty risk up to 20 grams per day, beyond which an upward trend emerged. The researchers emphasize that this finding was based on low-quality evidence and may reflect confounding factors rather than causal relationships. Atherosclerosis development. A comprehensive 2025 meta-analysis of 26 studies involving 326,513 patients found no significant overall association between alcohol consumption and atherosclerosis development. However, subgroup analyses revealed important variations by arterial location, suggesting that alcohol's vascular effects may be site-specific and influenced by additional factors such as drinking patterns and individual susceptibility. Conclusion. The latest scientific research presents a compelling case that alcohol consumption poses significant health risks across multiple organ systems, with many effects beginning at very low consumption levels. The emerging evidence challenges previous notions of protective effects from light drinking and emphasizes exponential increases in risks with higher consumption. Key findings include the absence of safe consumption levels for cancer risk, dose-dependent increases in liver disease progression, complex cardiovascular effects that vary by outcome and population, and substantial global mortality burdens. Future research should focus on mechanistic understanding, individual risk factors, and the development of more effective prevention and treatment strategies. The current evidence strongly supports public health policies aimed at reducing alcohol consumption and improving treatment access for alcohol use disorders. That's all for today's topic. Subscribe to the channel and follow the forefront of health research.